Whoa!
And welcome to the Beef on Bovine Anaplasmosis. My name is Caitlin Doskasill.
And I'm Molly Kuhn. We are both freshman biomedical science majors at Texas A&M University, and we're excited to share our findings on bovine anaplasmosis with you.
Let's begin with a quick overview of the history of bovine anaplasmosis.
In 1910, Sir Arnold Thaler was the first to discover Anaplasma marginal in South Africa. Anaplasma marginal leads to bovine anaplasmosis, which resides mainly in tropical and subtropical areas. The disease is transmitted from insect vectors such as ticks and biting flies, and also from blood-contaminated fomites such as vaccines, ear tags, and castration and dehorning supplies. This is an infectious, non-contagious disease that causes severe loss to the dairy and beef industry. Cattle of all ages are susceptible, but the severity of the disease increases with age. Symptoms of bovine anaplasmosis include anemia, weight loss, abortion, jaundice, uncoordinated movement, and in certain cases, death. The disease starts in the developmental cycle of ticks, where their gut cells are infected, and then transmission will occur from the salivary glands during feeding. Major surface proteins play a crucial role in the interaction between Anaplasma marginal and host cells because they contain adhesive proteins that undergo changes in selection in cattle, causing the infection to be very persistent. There have been different strains identified all over the world, all having different genotypes and infectivity for ticks, which show that this disease is evolving. The diagnosis is made by looking at Anaplasma marginal on blood-stained slides only during the acute stage. It cannot be detected using this method in carrier animals or in animals that show no symptoms. Bovine anaplasmosis has 4 stages: incubation, developmental, convalescent, and carrier. During the incubation stage of the infection, Anaplasma marginal occurs until 1% of the red blood cells are infected. This stage will usually last about 3 to 8 weeks, and during this phase, the anaplasma parasites are reproducing in the animal's blood, and the animal will show no signs of infection. The next stage, developmental, lasts approximately 4 to 9 days, and clinical signs will start to appear about halfway through this stage. The body will start trying to destroy the parasite, but red blood cells will also be destroyed in the process, causing anemia. The animal's temperature will also start to rise to about 104 to 107 degrees Fahrenheit, and milk production will decrease greatly in lactating animals. Producers will start to notice the animal is sick when they become weak and refuse food or water. The animal will either die or start to recover 1 to 4 days after the first signs of disease appear. If it's not detected in the early stages of this phase, then they are usually not given treatment because the animal risks dying from lack of oxygen, and also antibiotics will not help after this phase has completed. The next stage, convalescent, is for cattle that have survived, and they will typically lose weight and abort calves during this stage. If they survive up to this point, they will start to recover over a period of 2 to 3 months. This stage will last until the red blood count returns to normal. Carrier stage is the last of the 4 stages, and this stage will last throughout their lifetime because once infected, they remain a carrier for life with no signs of infection.
Now that we have had a brief overview of the history of the disease, let's talk about how to treat it. Tetracycline antibiotics are the most widely used treatment for bovine anaplasmosis in the U.S., but there are also other options in foreign countries such as single immunocarb injection. Cattle may be sterilized by treatment with these drugs and remain immune to severe anaplasmosis for up to 8 months. Administering tetracycline antibiotics in the early stages of the disease will usually ensure survival of the infected host. Tetracycline is given as an intramuscular injection, usually into the neck, muscle, or the rump. In order to prevent muscle inflammation, veterinarians recommend injecting no more than 10 milligrams per injection site. Cattle that are in the early stage of the infection, also known as the carrier stage, are generally administered a 20 milligram dose of oxytetracycline. Carrier state elimination programs must include a post-medication serologic testing. Imidacloprid is also highly effective against A. marginale as a single injection. Elimination of the carrier state requires the use of higher repeated doses of imidacloprid. It is also shown to be an effective means of curing anaplasmosis. It is not approved for use in the USA or Europe because it has a suspected carcinogen with long holding periods. In South Africa, Australia, Israel, and South America, infection with live A. central, which originated in South Africa, is used as a vaccine to provide cattle with partial protection against the disease caused by A. marginale. This is a single-dose vaccine that produces severe reactions in a small proportion of cattle. This vaccine usually contains A. marginale in small portions and can be used to make the animal more immune to the infection, similar to the way human flu shots work. In the USA, where live vaccines cannot be used, vaccines comprising of non-living A. marginale collected from infected bovine have been used here in the past but are not currently available. Although A. marginale grown in tick cell cultures are being investigated as an alternative live vaccine source. In more severe cases of anaplasmosis, blood transfusions can possibly cure the infected animal. Although there are means of treatment for bovine anaplasmosis, usually by the time cattle producers see clinical anaplasmosis, the animal is almost over the acute infection and is suffering from anemia. Any excitement or exertion could cause the animal to collapse, resulting in death.
Treatment of the disease is important because of the severity of the symptoms, and one farm knows these effects firsthand. A case study was done on the outbreak of bovine anaplasmosis on a farm in San Miguel, Colombia. The farm had been established for 50 years with no outbreak, but since the climate is changing, the disease is spreading to new areas because it prefers a tropical or subtropical climate. There were 37 clinical cases and 6 deaths occurred in the affected animals, which were all under the age of 4. The cattle had symptoms including fever, decreased or loss of milk production, anorexia, depression, abortion, and death. To diagnose these cattle, they used the Glemsa stain blood smears, which confirmed the presence of rickettsia in their blood. Most of the animals responded well to the treatment given, with the exception of those 6 deaths.
In addition to treating the sick animals, methods should be used to provide protection for the remainder of the herd to halt the outbreak from the beginning. As with most diseases, preventing the disease in the first place is the ideal scenario. Using fly tags, spray-on insect repellents, and insect-repelling rubs are effective means of keeping the anaplasmosis vectors off of the livestock. Another option is to put chlorotetracycline in the feed at a low level to kill the organism before it can replicate and attach to red blood cells. Changing needles for each cow when administering vaccines is also veterinarian recommended in order to prevent not only anaplasmosis, but also many other diseases. Unfortunately, anaplasmosis can still find its way into your herd. Since anaplasmosis targets older cattle, keeping an eye on your adult cows and bulls is advised. At the first indication of anaplasmosis, gather all animals older than 6 months of age and administer 3 to 5 milligrams of oxytetracycline per pound of birth weight. This treatment must be repeated at a 28-day interval throughout the vector season. After withdrawal of the medication, close observation should continue for symptoms of anaplasmosis that may have been only delayed, not stopped. When you spot a cow that seems to be infected with anaplasmosis, there are precautions to take for that cow and the rest of the herd. Dr. Meredith Jones from the Texas A&M College of Veterinary Medicine and Biomedical Science advises, if you suspect a cow to have being infected with anaplasmosis, don't chase her with a horse or dogs if you can help it. You really need to handle them delicately to reduce their stress as much as possible.
Although this disease is not completely preventable, we hope that we were able to provide those of you interested in starting a cattle herd with insight on proper care and hopes of preventing this disease. We hope this podcast has been informative for all those interested in learning more about bovine anaplasmosis.
Thank you.